Hi there, you may be wondering why I turned in a YouTube link for this PowerPoint, and it's because unfortunately the word that's free, the PowerPoint that's free on the Nevada State College website doesn't have the capability of recording speech, but I decided this was a good resolution in the place of it. So I'm Sarah, and thank you for watching my PowerPoint from silence to voice. What is the public's view of nurses? From Silence to Voice, there's a quote of when a nurse was recorded in a video taken in a hospital, and they asked her about how she thought the public's view of nursing was, and she stated, "Nurses are often thought of as angels." She explains that this ignores that many nurses have a college-level education and a science background. Nurses, she says, have a range of critical thinking skills that they apply to take care of both people and their illness. I think the quote of "people are angels" truly underestimates the intelligence and education and the passion that nurses have. And then secondly, on the brighter side, I do think that at least it shows the appreciation of nursing care that some people do have about nurses. The silence of nursing. What do I believe it is? Well, I think the silence of nursing neglects to acknowledge the intelligent and hard and caring work that the nursing profession provides to a person or persons. This includes, we don't talk about Caritas nursing like we do within school. Other people don't know that we truly study how to care for other people. In addition, there's a lot of research that we put into not only caring science, but nursing in general, evidence-based practice and all that. And then thirdly, we use all kinds of resources that people don't realize we use, such as professional organizations. We work with doctors, we work with other professions, social workers. I don't think people know that about nursing, and it's the silence of nursing, I guess you could say. Advancement of public understanding. Well, in the book it talked about two things, that there's two kinds of communications. Internal communications, which involves within an organization. So for example, nursing, sometimes we are involved in the media, but just that kind of population reads about us, just nurses ourselves or other healthcare providers. And then what we need to do to help advance the understanding of the public is to try to reach for external communications, which has various audiences, and it tries to convince them to pay attention and support our development. So some examples of those would be newspapers or news channels, communities, etc. Things that aren't normally just within nursing. And why a nurse and not a doctor? I liked this meme right over here. Smart enough to be a doctor, chose to be a nurse. For me, I fell in love with the balance of science and human caring that nursing offers. Doctors have a lot of education, they're very respected, very knowledgeable, but in my opinion, I don't think they truly embrace the caring factor and don't have the time really to have caring moments with patients, and I truly treasure that relationship with my patients. The media's reporting. I think the problem is the media is not reporting very much about nursing. They don't really understand what we do, in my opinion. So some of the solutions so we can better this is to get in contact with different media platforms, such as websites or TV shows, newspapers, etc., that aren't purely nursing, actually that are not nursing, so that way we can spread the word about each other, and we can piggyback on dramatic or sensational events already happening to better get the word out there. If people are already reading it and then we piggyback on it, they're going to read about us more as well. So some examples are tragedies, new study, even Nurses Week. Or in legislation, if a new law comes out, that's a great opportunity for us to advertise ourselves with the new law, or actually, or if it needs to be, go against the law. And I like this meme right over here, Nurses React to Senator Walsh. I think everybody heard about this controversial statements from Senator Walsh saying that nurses play cards, and that would have been a great opportunity to break the silence of nursing and let the media know what nurses really do. Staffing ratios. Well, in my opinion, staffing ratios will always be an issue as long as nurse-to-patient ratios are not mandated by law. So, for example, in California, it is mandated by law to have a nurse-to-patient staffing ratio. So they don't really have a staffing problem, but me in Nevada, the hospitals here in Nevada, we don't have any laws mandated in. So, I mean, there is an issue with staffing. One way we can try to fix this is using media. We can take advantage and speak of sentinel events, even going as far as having patients or surviving members of patients speak about their experience due to staffing ratios. We can come together and lobby for the approval of legislation to mandate staffing ratios. We can use unions within our hospital. I know my hospital has a union, but it's not a very active union, so it doesn't really quite go anywhere. And then another way we can try to get staffing ratio issues resolved is trying to pursue Magnet Hospital accreditation. And this isn't something that us as nurses can do by ourselves, but we can definitely work with our organization and our hospital to get this accreditation. And I know these hospitals have very limited staffing ratio issues. Thinking differently, mixed opinions after reading this book, I do have mixed opinions. So one pro of breaking the silence of nursing, one pro of not breaking the silence of nursing is that nursing silence will equate to trust being maintained. I think that if we start, opening a can of worms, some deep, dark secrets about nursing might come out, and we may not maintain our trust with the public. So that's where I think one side of me is, and the other side of me thinks that it's we are also indirectly hurting ourselves by not making the public aware of our issues. And that, by that I mean that if we don't talk about what's going on with nursing, we're not going to get the support we need from other organizations to help improve these issues. Improving statistics as far as nurses being represented very little in the media, even though we are the largest part of the healthcare system. Right now, social media, I think, is a great platform to use to spread the word about things, about events and issues going on in healthcare and nursing. We can use legislatures or reach out to the community. We can join professional organizations because if you're not very aware of some issues that are going on elsewhere in nursing, that's a great way to network and find out what other nurses are doing. Also, power in numbers. We are the largest part of the healthcare system, so if we all speak, then we're going to be heard even better. And also the timing, and I touched on this earlier, we need to be a little more strategic about when we talk about things. And as I mentioned earlier, the controversy with Senator Walsh was a good opportunity to piggyback and talk about what's going on in nursing and what we actually do for patients. The articles that I found, one of them was called TV Nurse, Promoting a Positive Image of Nursing. This article talked about the different television shows that are on right now, including Nurse Jackie, Hawthorne, and Grey's Anatomy, and Mercy. It mentioned in the article that it's both a good and a bad thing that nurses are being portrayed in the media. Good because at least we're talking about nurses and we're acknowledging the presence of nursing. The bad thing is they're not portrayed what's the word I'm looking for? They're not portrayed truthfully. So, for example, in Nurse Jackie, sure, she's a great nurse and she's got all this experience, but unfortunately she has a drug problem. Now, some may say that could be true of nursing. Sadly, we do have a diversion problem in some states, but at the same time, that's not all nursing is. And then in Grey's Anatomy, nurses are looked as the doctor's assistant. Frequently, you'll see the doctors in the show be the one to discover a coding patient, and in reality, that's not how it works. Most of the time, it's the nursing staff that discovers a deteriorating patient. And then ways to change this is to advocate for moral clarity and positive image of nursing. And they said one of the ways is to use word of mouth. And this kind of goes hand in hand what I said earlier with power in numbers. If we all talk about our stories and we talk about what we've been through and what's going on in nursing, the word's going to travel, and hopefully with some time the culture of how nursing is viewed will change. A second article that I read is Portrayal of Nursing in South Africa. It was a qualitative analysis of newspapers of how nurses were portrayed in the newspapers over there, and how nursing did break the silence over there, but it was backfired because they exposed, the newspapers exposed the heavy workload, shortages, bad healthcare institutions, poor care, and the suffering of these patients. Now, this, I think, can be argued that it can go either way. It's good for nursing and bad for nursing, because at least it's being talked about, and hopefully in their situation, if it's being talked about, there's something being done about it. But then at the same time, like I said earlier, it breaks that trust that the public has for nursing. And then here are my references. I'll just leave it here for a few moments for you to review, but I'll also attach my PowerPoint shows, to the drop-in box. Again, I'm sorry I couldn't record the speech over the actual PowerPoint, but I hope this is a good alternative, or good thinking outside of the box on my part. Thank you again for reading, and you have a good one.